On to the next disease of the urogenital system, we'll be talking about male infertility. All right, and male infertility is logical, okay? Except when we go into talking about it medically, guys, you say that it's not really logical, all right? But the logical reasoning towards male infertility is this: a male is not being able to get a female pregnant. Do you understand? All right, so that's just male infertility. So discuss male infertility, and there are so many things to male infertility, right? So I group them into the definition, into the common causes, into the diagnosis and treatment, into different treatment options, right? And that's the end of the lecture, right? So coming back here now, what is the definition of male infertility? We say that male infertility refers to a sexual matured male's inability to impregnate a fertile female. Do you understand? So the female must be fertile, all right, to actually prove that you are infertile. Do you understand? So uh, in humans, it accounts for 40 to 50 of infertility and affects approximately 7% of all men. All right, so 7% of all men in the world have this male infertility. So semen quality is one thing you should consider. All right, so the man can be having semen, but it could be that this semen does not have sperm in it. It could be that the semen is only seminal fluid. It could be that the semen is not having sufficient number of sperm in it. It could be that the semen is having weak sperm in it, right? So semen quality, male infertility is often linked to deficiency in semen quality, all right? So semen serves as a surrogate measure of male fecundity, okay? So abnormalities in sperm production, function of the sperm, or blockage can contribute to fertility issues. Right? I've already slightly hit a point on it. So sperm production is basically like you having you not having a sufficient number of sperm in the semen. All right, you know the semen contains the sperm, the seminal fluid, and so many other things, right? So if you're not having sufficient number of sperm in this semen, then you know that it will lead to infertility, right? Then blockage is basically like, okay, what is the tube that is bringing sperm to the testis? Okay, what is the tube that is taking sperm from the testis to the penis? That should be the vast difference, right? That should be the vast difference. So imagine that there's blockage in the vast difference, or the vast difference has even been cut. Then you are producing sperm, but it's not being transported to where it's supposed to be. Do you understand? So now, what are the common causes of male infertility? There's testicular dysfunction. We said that issues affecting how the testis function can lead to infertility. Okay, because the testis is where sperm is being stored. Okay, so these may include genetic factors, traumatic factors like injury to the testes, infections, or disease of the male reproductive tract. Okay, so this is male infertility. Talking about function of the sperm, it has to do with the shape of the sperms, all right? So you can see this is a normal tail of a sperm, and you can see this is a malformed tail of a sperm, all right? So hormonal imbalance too can also cause male infertility. We said that hormones play a crucial role in male fertility. So imbalances in these hormones can actually impact sperm production and function, all right? Most especially the androgen. So duct blockage or absence. We said that some men may have blockages or absence of ducts in their reproductive organs, okay, hindering the passage of sperm. All right, we already spoke about this in testicular dysfunction. Then lifestyle factors: if you smoke, you excessively consume alcohol, and you have a poor diet life, it can also influence male fertility. All right, causing them to become infertile. Then about the age. Advanced age can affect sperm quality and fertility. All right. So if you are too old, it can also affect your sperm quality and fertility. All right. So several factors here in one picture, and I'd like you guys to just pay attention. All right. So this one has to do with the sperm. So pay attention. So sperm count can also affect male fertility. You could see a normal sperm count. The sperm should be so much in the semen, all right? So if you're having low sperm count, then you are not actually having a fertilization, all right? The chances are low. The sperm morphology, there's how a sperm should look like, okay? There's a standard structure of a sperm, all right? So if you find a sperm looking like some weird cells and all this stuff, then you know that this is a normal sperm, this is an abnormal sperm, all right? Of course, this sperm cannot fertilize, okay? So this one now, you have the male producing sperm in adequate number, but it is basically producing abnormal sperm, all right? Then sperm motility is basically the movement of the sperm, all right? So there's how a sperm should move even, all right? They call it the corkscrew. All right, so the head is moving and the tail is like rounding. All right, so it's basically like a screwdriver stuff. Okay, so the tail is like screwing the head into. Do you understand? So if you have an abnormal sperm motility, it will also cause this male infertility. Right. So now, what is the diagnosis for this crazy health condition that have been troubling a lot of homes? There's medical evaluation. It's that a thorough assessment by a healthcare provider involves analyzing medical history, physical examination, and semen analysis, right? With semen analysis being the most important one that will actually verify, or how will I put it? Uh, um, yeah, that will verify that, okay, yes, this is actually, um, there's infertility. Do you understand? So treatment options could be lifestyle modifications. You don't really rely only on drugs. Maybe if there are some things in your lifestyle that are actually causing you to be infertile, then you need to stop them. Things like you should encourage healthy habits. Okay, so you should quit smoking. You should quit taking alcohol. Alcohol is not here, but I'm telling you, you should quit taking alcohol, and you should maintain a balanced diet so that your sperms will be looking healthy, bro. So medications, there are some medications that could address hormonal imbalance or infections directly. Then assisted reproductive techniques like in vitro fertilization, intracytoplasmic sperm injection, and other methods may be used to achieve pregnancy. Now, let me add more points on this. It could be that the duct carrying sperm from the testes to the penis is cut off, right? So basically, you still have sperm, though. Do you understand? So they could take this sperm and actually get to fertilize your wife. In vitro means outside, okay, outside the uterus, okay? So they take your sperm, they take the egg, and they fertilize it outside, okay? So intracytoplasmic sperm injection means that they take your sperm, like one sperm, and they inject it directly into the cytoplasm of the oocyte or the egg, okay? So guys, I think that's it about male infertility, causes, diagnosis, treatment, and everything. All right, so bye for now, guys.